Hello students, I am Dr. Sunil Kadam and I shall be taking a class on the chapter called as Deliriant Poisons. This chapter will be divided into two parts and two classes will be taken simultaneously. This is the first class. So part 1 will be talking about what are meant by deliriant poisons, what are the examples for deliriant poisons, and among them few of the poisons or few of the deliriant poisons I will be talking. So deliriant poisons include the one that is famous, that is the Datura. Then the other example is Atropa belladonna. Third one is Hyoscyamus niger. Fourth, the cannabis, and the last one being the cookie. So what are actually these deliriant poisons? These deliriant poisons are nothing but the poisons which produce delusional effects or hallucinational effects, or most commonly the delirium, and hence they are named as deliriant poisons. So the first two I will be talking today, that is Datura and Atropa belladonna. Even Hyoscyamus niger also resembles in signs and symptoms similar to the Datura and Atropa belladonna. In detail, I will be talking about Datura in today's class. So Datura, what is this Datura? This is a species. Datura is a species which includes 9 species of poisonous plants. Not just poisonous plant, it is a poisonous vespertine flowering plant, and it belongs to a family of Solanaceae. What do you understand by this vespertine flowering plant? Vespertine means something or anything to do with the night. So what it does in the night actually? It is nothing but the flower, it blooms at dusk and stays open or closes down the next mid-morning, and hence the name vespertine flowering plant. So Datura is a genus of 9 species of poisonous vespertine flowering plant belong to the family of Solanaceae. Few of the examples I list out here, that is Datura fastidiosa, Datura ferox and Datura stramonium. There are a few more species which I have not listed here, and among these three, Datura fastidiosa is the one which we will be talking in our class. Why? I will tell you the reason. So Datura fastidiosa. This Datura fastidiosa or Datura plant is most commonly found in India, and hence we are discussing about this particular plant, Datura plant. So this Datura fastidiosa includes two types. One is Datura alba, which presents with a white flowered plant, and hence it is called as Safed Datura. The other one is Datura niger, which has a deep purple flowered plant, and hence called as Kala Datura. Coming to the characteristics of the plant. Characteristics means we are going to study how the plant is, whether it is a very tall plant or a small plant, and where it actually grows, that is the habitat, then how the leaves are, how the fruits are, and how the seeds are. And lastly but not least, what are the poisonous parts of the plant. So first point is its habitat. It grows on all waste places all over India. As I told you, this Datura fastidiosa is a plant which is found all over India, and it mainly grows on all the waste places. Plant, it is a leafy herb, that means it grows up to a 5 feet tall and has a woody stalk. The flowers, these flowers are bell shaped, they have 5 petals, and these petals open after dusk and hence the name vespertine flower, and they close by mid-morning next day. So Datura is a vespertine flowering plant, and these flowers also exude a pleasant narcotic smell at the night. If you ever happen to visit the Datura that is grown along the roadside or in waste places or in marshy areas, during the night time you will definitely encounter this pleasant narcotic smell. Be careful. The fruits, coming to the fruits are spherical in shape, they have sharp spines, and hence this Datura fruit also derives the name thorn apple. It is spherical and has sharp spines over it, and hence the name thorn apple. And among these fruits, when you cut open, you will see about 500 yellowish brown colored seeds, and these seeds almost resemble that of a chili seeds, but there is a gross difference which I will be telling in my next subsequent slides. So the fruits are spherical with sharp spines, and hence the thorn apple. There are 500 yellowish brown seeds in each fruit, and they resemble chili seeds. And coming to which part of the plant is poisonous? Remember, all parts of the Datura plant, including the nectar, that is honey that exudes from the plant, is also poisonous. And most poisonous are the seeds and the fruit. In fact, the seeds are within the fruit. Yes, definitely the seeds and the fruit are poisonous. So this is the picture showing the Datura plant, which has white colored flowers, and this resembles a bell-shaped flower. I'll show you in next picture. This is a Datura plant with a deep purple colored flower. So both are Datura plants, and this bearing the white flower is called as Datura alba, and this bearing the deep purple colored flower is called as Datura. So we'll have a closer look of the flowers. So this is a white bell-shaped flower, a vespertine flower which blooms at dusk and closes by mid-morning next day. And similarly, this is Datura niger, which has a deep purple colored flower. Same character, that is a vespertine flowering plant. Coming to the picture of a Datura fruit. As I told, it is called as thorn apple. Why? Because it is spherical in shape and has soft spines over it, and hence the name thorn apple. So this is the picture depicting the Datura fruit. You can see it is spherical, it is round in shape, and these are short, soft spines. This is another picture. Considerably, you can see a bit longer spines here, but these will also be soft in nature, and hence the name thorn apple. Coming to the Datura seeds, the color of it is either dark brown or yellow brown in color. These are about 500 seeds present in each Datura fruit. That is, the picture shows the seeds present within, in situ, within the Datura fruit, which is cut open. Here you can see the Datura seeds separated from the fruit. You can see the color, it is almost yellowish brown in color. And there are few characteristics which I will be talking a bit later. This is about Datura seeds, which almost resemble chili seeds, but there is a difference to identify. Coming to its active principles, Datura plant contains about 0.2 to 1.4% of alkaloids. Now you may be wondering, what are these alkaloids? What is the name of these alkaloids? The first one being the scopolamine, also called as L-hyoscine. The second one is atropine. The other names are the DL isomer of hyoscyamine, or the old name daturine. In few of the older textbooks you can also find this name, that is daturine, also, and another name for atropine. The third one is hyoscyamine, and the old name for this hyoscyamine is duboisine. So this daturine and duboisine are the older names used for atropine and hyoscyamine respectively, and you may find these names in some of the older textbooks. Coming to its mechanism of action, Datura contains these alkaloids, that is atropine, hyoscyamin and hyoscine. These competitively inhibit the muscarinic effects of acetylcholine. That means, in short, to say that they bring about inhibitory effect on the action of acetylcholine. So the brain gets stimulated first and then it is depressed and paralyzed by the effects of these alkaloids. Similarly, the respiratory system, which is stimulated first and then depressed. Even these alkaloids, that is atropine, hyoscyamin and hyoscine, also have peripheral effects which are mostly anticholinergic in nature. So signs and symptoms. First we'll look at the appearance of signs and symptoms, or the period within which time the signs and symptoms appear. Usually you know that all these signs and symptoms are anticholinergic effects due to the action of these alkaloids. So once you ingest the seeds, so the symptoms start appearing within 30 minutes, or at least 30 minutes is required for the signs and symptoms to appear after the ingestion of the seeds. Whereas if a person consumes a decoction of seeds, then signs and symptoms appear very quickly, that is within 5 minutes. But if an alkaloid is ingested directly, that is either atropine or hyoscyamin or hyoscine, if it is injected, then the signs and symptoms appear within few seconds. Always remember that the Datura produces anticholinergic effects in the body, that is action opposite to the action of a acetyl. So now what are the symptoms? One by one we'll study. The person has a bitter taste in the mouth. He also has symptom of vomiting, burning pain in the stomach. The face, when looked, it appears flushed and the conjunctiva appears very much congested. And in the eye, there will be loss of accommodation for near vision. The person will not be able to focus on an object which is at a near distance, and thus it results in temporary blindness. Along with this, the person may also experience photophobia and diplopia. Photophobia is nothing but he may not be able to see bright objects, and diplopia is the appearance of a double vision. And person may also experience the pupillary reflex to be sluggish in the beginning, later it becomes absent. The most important is the appearance of a pupil or a condition called as corn picker's pupil. In short, it is nothing but unilateral mydriasis, that is the dilatation of the pupil occurring in either of the eye. In any one eye, the dilatation of the pupil occurs. That is called as corn picker's pupil, and this is mainly because of the pollen that is passed from the flower of the Datura plant to the person's nearby. So that is corn picker's pupil. Then the person may also experience hoarseness of the voice. The skin of the person who has consumed Datura will have a rash, that is called as scarlatinal rash, or it may present as exfoliation. The skin, when touched also, it appears very much dry and hot. Dry, the condition is called as hypohidrosis, and it is very hot. Remember, these are the effects of atropine, right? In pharmacology, you know the mnemonic. You just refresh, you will come to know what it is. Effects of atropine. Person may also experience difficulty in urination, that is dysuria, which may progress to urinary retention. On the CNS, the person may have agitation, he may develop confusion, giddiness, and he may fail to recognize his friends and relatives, and he may also have delusion and hallucination. Characteristic features are coming now. So the person will also have delirium, that is, he makes restless and purposeless movements. What are these purposeless movements? You may see that person who is poisoned by the Datura may start pulling imaginary threads from the fingers. As though some threads have stick to his fingers, he starts pulling them one by one. So that is a purposeless movement. Or he may be having that movement of threading the needle, imaginary ones. Or he may pick bedclothes, imaginary ones again. So these are the symptoms of the Datura on CNS. And these imaginary purposeless movements are given by the term that is called as corphologia or flocculation. Patient, continuing, may be initially excited by the consumption of the Datura. He may be very talkative and he may have incoherent speech, and most important, he tries to run away from the bed. He may not be seated, so you need to restrain him. This is seen in case of treatment of organophosphorus poisoning, where you administer large doses of atropine. The person becomes agitated. He may not be able to, or you may not be able to make him lie calmly over the bed. He may become excited, agitated. So this is the feature of the Datura. And that excitement remains for 1 to 2 hours. This excitement remains for 1 to 2 hours, after which the patient goes into a deep sleep state, that is, becomes comatose. And in the last stage, the person's respiratory system gets depressed, which may progress to respiratory paralysis and death. So what are the signs of this Datura poisoning? When you look at the pulse rate is increased anywhere between 120 to 150 beats per minute. It is very much high and bounding pulse. Later this pulse becomes weak and irregular as a person's condition deteriorates. Respiratory system, the respiratory rate is increased, which may get later depressed and it may lead to respiratory failure. Likewise, even the blood pressure is increased. Temperature of the body is increased, causing hyperpyrexia. Muscle tones and reflexes are also increased. So these are the signs that you notice in a person who is being poisoned by Datura alkaloids. So whatever I talked about Datura signs and symptoms, we'll try to simplify them and put it in one particular chart. So some of the textbooks mention the 6 Ds of Datura poisoning or 9 Ds of Datura poisoning. In some of the books it is mentioned as 15 Ds of Datura poisoning. So we'll see all of them together in one chart. That is, the person who is being poisoned by Datura will exhibit following signs and symptoms. They start with the letter D itself, that is decreased muscle tone or muscle coordination. The person will experience delirium, which is most important. The person will also have delusion. He may have dermatitis. Then there will be dilated pupils, that is cornicus pupil, or dreadful hallucinations. Person may be drowsy. He may have a drunken gait, and his skin appears dry and hot. There are dry membranes because the secretions have been dried up. Similarly, dryness of the mouth and throat occurs. Then there is dysarthria, that is difficult in articulation because of the dryness of the mouth, and there is dysphagia, even difficulty in swallowing. And finally, the death occurs due to respiratory failure. Try to remember these, but most among them important would be the delirium, delusion, dermatitis, hallucinations, and dryness of the mouth, like this, and dry hot skin. So remember these. When asked, you can enumerate these signs and symptoms. So the fatal dose, if atropine or hyoscyamine is consumed. The fatal dose about 120 milligrams is the most important one. About 120 milligrams may turn out to be fatal in an individual. Or if it is scopolamine, a lesser dose is sufficient, that is 30 milligrams. And if at all, if the Datura seeds is consumed as such, then about 50 to 100 seeds would be sufficient to kill a person. Fatal period is always between or less than 24 hours if not treated effectively. Coming to the diagnosis, what are the diagnostic methods for Datura poisoning? There is one bedside test that is called as a pilocarpine test. That is, if we instill 2 to 3 drops of 1% pilocarpine into the patient's eye, and if you see that there is no constriction occurring of the pupil within half an hour, then it could be Datura poisoning. Because 1% pilocarpine, if instilled within a normal patient, into the eyes of a normal patient, then it produces the constriction of the pupil. But if no constriction of the pupil is seen, then in such case you can or may diagnose it to be Datura poisoning. The other one would be, or other test would be the mass spectrometry, that is the hair analysis by mass spectrometry. Atropine and scopolamine can be identified in the hair up to 3 weeks after exposure. So most specific one, that is the mass spectrometric method, that is hair analysis by mass spectrometry, that is atropine and scopolamine can be identified in hair up to 3 weeks after exposure. So what is the final stage of management of this particular poisoning state? Here I have already shown you that the physostigmine is the antidote of choice, and it is given 1 milligram IV or IM at hourly interval. But before you administer an antidote, remember that in an emergency, if a patient comes, the first and foremost duty would be to maintain the ABC, that is airway, breathing and circulation. So before you administer an antidote, you need to monitor the vitals. You stabilize the patient by recording the pulse, BP and respiratory rate. Then emetics can be used so that the poison, if it is present within the stomach still, it can be removed out. Then, as a routine, stomach wash can be carried. Stomach wash is usually carried within 2 hours after the injection, but in this condition even you can try even after 2 hours to 5 hours after injection, because some of the seeds may be present within the stomach which can be removed by stomach wash, and this stomach wash is usually carried out with a weak solution of tannic acid. Then you can also give activated charcoal for the adsorption of the unabsorbed poisons, whatever the remnants or the seed parts or the plant part is present within the stomach. So such things can be absorbed by the use of activated charcoal. You can also have the lower bowel being washed frequently to remove the poisonous material. And remember, once again I tell you that physostigmine is the antidote of choice, which is given 1 milligram IV or IM at hourly interval. Yes, these are the things that are to be done, but what are the things that should not be done, or what are the drugs that is not to be given to a person who is under the effect of Datura? Neostigmine, pilocarpine and pyridostigmine are the drugs that should not be given in a person who is poisoned due to Datura. The main reason for that is these compounds do not cross the blood-brain barrier, and hence they may not be effective in treatment of Datura poisoning. Similarly, another compound, that is morphine, is avoided in case of Datura poisoning. Why it is avoided? Because morphine also produces respiratory depression and Datura also produces respiratory depression. Hence the combined effect may be more severe, and hence morphine is avoided as it can aggravate respiratory depression. The rest of the treatment would be symptomatic, that is, the delirium that is produced due to datura is controlled mainly by bromides or short-acting barbiturates, ether and chloro. So coming to the post-mortem appearances, that the person who fails to respond to an effective treatment after the ingestion of a datura will be brought to autopsy. And what are the autopsy findings? Remember, autopsy findings are not that characteristic in datura poisoning. There is no specific finding seen in datura, but the signs are usually that of asphyxia, and the stomach wall is inflamed. You may also find seeds or the fragments of the plants within the GIT, and these seeds of the datura, they resist putrefaction for a very long time and they can still be seen in the GIT of a person, and lungs show edematous changes. So what is the medico-legal importance of this datura? I'll just put the slide here. So datura is most commonly called as a roadside poison. Why it is called as a roadside poison or also called as road poison is because it is easily available on the roadsides, and this availability makes the criminals to get hold of those seeds, and these seeds are crushed, powdered, and the extract they can be used by criminals for stupefying a victim prior to robbery, rape or kidnapping. So the seeds that are crushed, powdered seeds or extract of these seeds may be used by criminals for stupefying a person. These crushed seeds or powdered seeds or extract are mixed with food or drink, and they are given to travelers at railway stations or chowdhuries. And after consumptions, the victim usually becomes or goes into a sleep-like state, and the person may be robbed of his property, or the person may be raped if the victim is a girl, or the person may be kidnapped. Hence it is commonly called as a roadside poison. A similar application of this or misuse of this particular poison is the seeds are mixed with the incense wood, and the victim is exposed to the fumes which causes lethargy and sleep. I'll just give you an example here wherein some people who disguise themselves, or criminals who disguise themselves as sadhus or babas belonging to any religion, it doesn't matter, and they catch hold of people who are suffering and they say that they are going to cure their or wash off all their sufferings by performing a puja. While they perform a puja, then they make use of these datura seeds mixed with incense wood, and the fumes will somehow be transferred to the victim, and the person who inhales those fumes will go into a sleep-like state, and later these criminals resort to their old tactic, that is robbery, rape or kidnapping. So the other medico-legal importance is that the datura may be used as an abortifacient drug, or it may be used as an aphrodisiac, or the decoction of the seeds which may be added to the liquor or toddy, and thereby increasing the intoxicating property of that particular liquor or a toddy. And the most important would be the person who is suffering from delirium caused due to the intoxicating property of the datura. They may not be held criminally responsible if that datura is administered to him without his knowledge. This holds good even for other intoxicating substances such as alcohol also, that is section 85 of the Indian Penal Code. Any intoxicating substance which is administered to a person without his knowledge, and that person commits certain crime, then in that case the person will not be held criminally responsible if it is proved that the intoxicating substance that was administered to him was without his knowledge. I was talking about corn pickers pupil. I also told that it is a condition wherein you see unilateral mydriasis, that is dilatation of the pupil caused in only one eye due to exposure to the pollen of datura. But where it occurs, how does it occur? We'll see. That is, usually the corn fields, they are usually infested with these datura plants, and harvesting of these corn exposes those people who pick the corns, those are called as corn pickers, to the dust of datura, or also called the pollen of datura, and this produces unilateral persistent mydriasis. This is called as corn picker's pupil. A similar condition of unilateral persistent mydriasis may also be seen in gardeners who work in datura which is being cultivated for medicinal purposes. So that condition is called as gardener's mydriasis. The one and the same. Here the datura is infesting the corn fields, whereas in gardener's mydriasis, actually the person is dealing with the datura plant while they are cultivating it. So there are two conditions, that is corn picker's pupil and gardener's mydriasis. The medical legal importance of this pupil is some of the doctors fail to recognize this condition, whereas the people having this sign, they may be wrongly diagnosed as having cranial lesions. So it is better for a doctor, if you find a person who is having a unilateral persistent mydriasis, then an inquiry into the occupation of that particular person should be made. So this chart depicts the differences between the datura seeds and the capsicum seeds. Why I am talking to you about this particular aspect is because in the practical examination, these either the datura seeds or the chili seeds, also called as capsicum seeds, will be kept as spotters for identification and answering the relevant question asked. Right? Fine. First one is the size of the datura seeds. They are large and thick, whereas the chili seeds or the capsicum seeds are small and thin. When you closely observe, the shape of the datura seed is kidney shaped or bean shaped, whereas the capsicum seeds are rounded. The color of the datura seeds is dark brown or yellowish brown in color, whereas capsicum seeds are pale yellow in color. Another differentiating feature is the margin. When you look at the lateral margin of the datura seeds on the convex border, it appears to be a double edge, whereas the convex border of the chili seeds are simple and sharp. And a close observation to the surface of the datura seeds, you may find numerous small depressions, whereas capsicum seeds are smooth in surface. The most important is the smell. Datura seeds are odorless, whereas the capsicum seeds are pungent in odor. Similarly, when you taste the datura seeds, it appears to be bitter in taste, whereas the capsicum seeds are pungent to taste. The characteristic chili taste is C or tasted. So this is the photograph depicting the differences between the datura seeds and the chili seeds. So these are the dark or yellowish brown color datura seeds. So you can also closely observe that it is kidney shaped or bean shaped, and when you look at the lateral borders, it appears to be a little bit thick and has a double edge like, whereas this on the right side you see the pale yellow colored chili seeds which are thin, and even you can find they are rounded and most probably having a sharp borders. Coming to the next poisonous plant is Atropa belladonna. Sometimes it is also called as devil berries, or given another name that is called as deadly nightshade. This is a plant mainly seen in Europe and Asia. Here all parts of the plant are toxic. similar to the Thura plant. The active principles are L-hyoscyamine, and the roots of this particular plant contains about 3 to 15% of atropine and about 2.5% of scopolamine. The mechanism of action is similar to the Thura again. It inhibits the muscarinic effects of acetylcholine. The signs and symptoms are almost similar to that produced from the Thura, because the alkaloids or the poisonous material found in the Thura as well as Atropa belladonna are similar, and the treatment or the management of this particular person who is being poisoned by devil's berries also remains the same. The post-mortem appearances are also almost same, with asphyxial signs, inflamed GIT and edematous lungs. So this is about Atropa belladonna. In the next picture of Atropa belladonna, this is the plant with a flower, purple colored flower, and this is the fruit. Almost appears like a berry, but it produces poisonous effect, and hence the name devil's berries. So we come to the end of the class. Thank you very much, students. I'll be assigning you some assignment which will be posted on the Google Classroom. Kindly answer those assignment and submit before the time mentioned on the next day. Thank you.